Turning now to the growing concerns nationwide regarding the rise of COVID-19 cases, I want to welcome Dr. Celine Gounder. She's a member of the Biden-Harris Transition COVID Advisory Board. She's a practicing infectious disease specialist and an epidemiologist at Bellevue Hospital in New York. Also joining our conversation is Dr. Andre Campbell, an ICU doctor and a trauma surgeon at Zuckerberg San Francisco General Hospital. Welcome to both of you. Thank you for being here. Dr. Campbell, I want to start with you because we have reporting that we have hospitals more full than they were at the what we thought was the peak of coronavirus in April and May and June across the country. One of the whole points about flattening the curve was that the same number of people can get the infection, but if they get it at different paces, we will have the equipment to serve them, we will have the beds, we will have the doctors, and we will have the nurses. We are now up against the capacity that we've got to provide people with health care.
Good morning, Ali, and thank you so much for having me this morning. You are absolutely right. We are at the brink in terms of the healthcare system with respect to dealing with these patients. When everything happened in the window of March or April, we knew what happened in New York and Northeast, Midwest, but now it's happening everywhere. And at that time, we could have doctors, nurses moving around and providing help. But right now, there is a countrywide problem with respect to the way that resources are being allocated. And the healthcare system is getting overrun. The resources are being exhausted from the standpoint of PPE, but the staff, the nurses, the doctors, the respiratory therapists, the ED physicians, all the whole team that cares for people in the ICU is becoming exhausted in many parts of the country. And this is a major catastrophe for our healthcare system because we don't want it. Right now it's 80,000, but what does it look like when it's 150,000? I mean, at that point, then resources will be exhausted.
And Dr. Gounder, while we are very excited and rightfully excited about the Moderna and the Pfizer vaccines, once again, it's going to come down to PPE, nurses, cold chain storage and distribution. It's going to come down to all those things that we actually need White House leadership for, maybe military intervention in, maybe Defense Production Act impositions to produce the necessary things. That there is a virus doesn't mean everybody's going to be able to get the virus near them. I'm sorry, vaccine.
Yeah, I mean, well, and this is why the GSA really needs to move forward with ascertainment now. We really do need to get our hands on critical information to understand everything from what do we have in terms of personal protective equipment, what is the quality and number of ventilators that we still have available that could be moved around and redeployed. One of the major issues we saw with that earlier in the pandemic was that many of the ventilators in the stockpile were dysfunctional, did not work. And, you know, other things like what are the current plans, what are the current negotiations with pharmaceutical companies, with distributors on where they're going to be targeting the vaccines, how that's going to be distributed. How are you going to hire all of the nurses who are going to be needed to administer that? And that's all in the middle of a pandemic when the demand on healthcare providers just to cope with the existing COVID patients is at an all-time high.
Dr. Campbell, we've been taking questions this hour from people about how to handle travel this week and Thanksgiving this week, and all of my experts say the same thing. If you don't have to travel, don't travel. If you don't have to have members who are not of your family in your house, don't do it. But the bottom line is people will. Airports are full today. People are traveling. People will be with their families, and we will see probably an increase in infections in the next week or 10 days. And then after that, unfortunately, our hospitals will get fuller. What do you see happening here? Because we are not getting consistent guidance across the board. The CDC finally came out with delayed guidance far later than people had made plans about not traveling for Thanksgiving. We're still getting mixed messages across this country.
Well, I think that that's a good point, Ali. I think the first thing is that if you don't have to travel, don't travel, or the message should be stay at home, enjoy Thanksgiving with your immediate family, don't go anywhere. That's number one. If you're going to travel, then it's going to be a risk. And what I am concerned about, and all the healthcare providers are concerned about is that when we look at 2 weeks, as you said, from now, instead of having 80,000, we'll have 100,000 people because there's a delay there. So my strong recommendation is for people to stay home, because you would like to just get through this period where we can get access to the vaccination that Dr. Gounder is talking about, and the Biden administration is going to work on and getting it to us in terms of the vaccination, because we're close. But the problem is that people want to see their families, and the thing I want to message is if you see them for Thanksgiving, they'll be in the ICU for Christmas. And that's the thing you don't want to have. And that's what I fear that's going to happen because of all this traveling. If 2 million people travel like they normally do, we're going to have way more cases because the dangers inside the airports, inside the transportation facilities, inside the hotels, the homes. It's getting out of your pod, getting away from the people that you are with all the time. This is a problem. In California, we have a big outbreak. We have 13,000 cases a day for the last 3 days. So we are going up. Where we were things are under control here. Things are rapidly getting out of control, and public health officials are beginning to issue shutdown orders because we're having problems. And we don't want to go there. We just want to make sure that people are healthy and they get through this.
Celine, yesterday we had the first coronavirus task force meeting of the Trump administration in a very long time. The president himself wasn't there, and we don't seem to have new guidance. It's kind of sad that the stuff that I talk about on cable news, they get to later. I mean, they just around get to the things that we're already telling people with the maps that we use to tell people what's going on. What we are seeing is spread because we're not getting consistent messaging from the federal government still.
Yeah, that's right. And it's pretty clear that the consistent messaging needs to be that we need to all wear masks. Masks are highly effective in protecting the person who's wearing them, protecting others. They're cheap, and they don't shut down the economy. So if you want to keep the economy open, you should wear a mask. It's like politicizing toilet paper. A mask is a basic hygienic measure. This is not a political statement. We also need to be massively ramping up testing. You should be going out and getting tested before you spend time with family over the holidays. If that is something you choose to do, really, you should have quarantined for 14 days first, gotten a test right before seeing family, and then also consider retesting again a few days later, 5 to 8 days later. These are the kinds of things we need to be hearing, not just on cable news, but from our elected officials.
Yeah. Well, one day. Thank you to both of you. Dr. Celine Gounder is a member of the Biden-Harris Transition COVID Advisory Board. Dr. Campbell is an ICU doctor and trauma surgeon at Zuckerberg San Francisco General Hospital.